Before you is Grace Amenya, a co-author with Daniel Kurui, and soon we are going to have our research up. Yes, we are lecturers in KMTC, and it became as a felt need that we needed to assess our products for quality. So this was done, these are factors influencing utilization of the nursing process as perceived by third-year nursing students in Kenya Medical Training College. So in our globally nursing process, application has proven to be a valuable tool in nursing, and this is what we can claim in the nursing profession that we have. And therefore, our objective was to determine the factors that influence it, and specifically assess knowledge, attitude, and practice, and also institutional factors. Our methodology was descriptive, cross-sectional study, done across our nation within the 8 provinces, former 8 provinces of Kenya, using hospitals that are established and have comprehensive services. Quantitative data was collected using self-administered questionnaires, and purposefully selected the 8 KMTCs that I have just explained: Garissa, Mombasa, Nairobi, Machakos, Nakuru, Kisumu, Eldoret, and Kakamega. The third year are considered mature and ready for the market. And therefore, looking for those hospitals and KMTCs, we needed to have the qualitative to complement the data. And we had 10 key informants from mainly the hospitals adjacent to the KMTCs. Outcome measures that we will be looking for and targeting are knowledge, attitude, practices, and indeed the institutional factors. Results. On knowledge, the source of information on the nursing process came out from the lecturers, majority, and then CMEs. And the ability to indicate correctly the parts of an actual nursing diagnosis, we can see 97.6% were able. Outlining the correct order of the nursing phases, 82.2% were able to do it. And in most key informant interviews, 90% agreed that the students had knowledge of the nursing process. On attitude, respondents feeling that the nursing process should be applied to all patients, we had 77.4% feeling that the process always contributes to wellness of the patient. And however, we had 142, that is 38.3%, that felt the application of the nursing process was cumbersome. On the key informants indicated, students are often pushed or followed to implement nursing process. We had to do an odds ratio, and when you look at the behavioral attitude, knowledge, attitude, and behavioral attitude, we looked at that, and the odds ratio indicated that the odds of an increase in perceived knowledge of respondents increases their behavioral attitude 5 times. On practice, most 328, that is 88.2% of the respondents indicated they used nursing process. And most, that is 157, 48.3% of the respondents having formulated nursing process or care plans, 3 or more nursing care plans in one shift, 67 in 2, and 101. All key informants opined that students use nursing process when closely supervised or during clinical assessments. On institutional factors, the resources required for the implementation of the nursing process, 53.2 said it was adequate, and not adequate 174.46. And that 174 cannot be ignored because 46.8 is still a little bit bigger number. Whether nurse-patient ratio was optimal for the implementation, we had 42 indicating it was, and then 42% indicating it was, while 57.3 said it was not. The resource available for implementation of nursing process in facilities, they were listed there: stationary, mentors, and you can see the percentages they are taking. Standard operating procedures, and then we had the key informants agreeing that, all of them agreed that there are adequate resources to support the nursing process, except the human resource. Discussion. This agreed with a study by Kaiga that is on knowledge, on attitude. 77.4 of the student nurses in this study had a favorable attitude, and this contradicts a study in Thika Level 5 hospital. On practice, 88.2 of the respondents indicated they used the nursing process in patient care, findings that are higher than a study in Madare. Then the study established most 337, 90.6 of the respondents indicated that the hospitals were supporting nursing process. This is higher than a study that was done in other by Mbithi et al. In conclusion, majority of students, nurses had good knowledge, positive attitude, and practiced the nursing process as per their expectation. The patient-nurse ratio was low, affecting the implementation of the nursing process. Therefore, our recommendation, health institutions need to provide SOPs in clinical settings, and complementary findings on practice revealed the need for improvement on behavioral attitude that is affecting nursing process. And regular CMEs on using for use by nursing students need to be enhanced. Thank you.